Well-designed work means better outcomes for individuals, teams, and organisations. But can we improve work if it's poorly designed, and if so, how? Let's consider some research conducted in a UK civil service department. In this department, managers were under pressure from trade unions to address reports of poor well-being and high turnover rates among call centre agents. Professors David Holman and Carolyn Axtell suggested that these issues might be a consequence of poor work design, and that the process of work redesign could be an effective tool for addressing the issues that had been identified. This idea received a high level of support from the department's management team. Supported by the researchers, the call centre agents and their supervisors worked in small groups in a series of workshops to improve their work design. The process involved three main steps. First, the groups assessed the situation, mapping out the core tasks of the agent's work and identifying the obstacles that prevent them from working effectively. Second, the groups generated ideas for the work redesign. The employees discussed and evaluated 3 scenarios, each focusing on maximising a different set of outcomes, and identified the changes that would be necessary to achieve those outcomes. Last, the groups were tasked with implementing changes. Each group developed redesign proposals, which were then agreed upon in a meeting with the employees, managers, and researchers before being implemented into the workplace. The assessment phase identified work design problems that are common in call centre work. First, workers had a lack of control over the timing and methods of their tasks, restricting an aspect of work design known as agency. Secondly, the workers were unhappy with the way their performance was being assessed, restricting an aspect known as mastery. To address the risk of low agency, workers were given increased control and responsibility over tasks and decisions previously carried out by the team leader. Additionally, a new system was developed which gave agents more choice over how and when they respond to customer query and complaint emails. To address the risk of low mastery, performance criteria was revised to improve clarity and feedback was simplified. All of the changes were supported by increased training to ensure that call centre agents had the skills to make effective decisions and address customer queries. By comparing a group of employees who had the redesign changes with a group that did not, the researchers showed that the redesign improved call centre agents' mental health and well-being, along with their belief that the organisation had done its duty in providing good quality work. In addition, the agents with the redesign changes performed better in their roles, as rated by their bosses. This shows that redesigning work to reduce the risks of low agency and low mastery was beneficial for the call centre agents and the organisation. As a final note, we asked the authors to reflect on what contributed to the success of this intervention, and they gave us a few useful tips. First, the management team was supportive of the employees' redesign ideas, resulting in a smooth implementation phase. Second, involving the workers themselves in the redesign process helped to both develop appropriate solutions and gain acceptance of the changes. In short, when work redesign has both manager support and worker participation, it can be an effective tool for making your workplace smarter.